less than 2 months since the vaccine rollout in India at least, India is quickly emerging as the pharmacy of the world, one of the prominent makers of the vaccine, and a nation that is generous enough to ensure that it is giving enough vaccines to countries that need it. We're currently supplying vaccines under 2 or 3 very important schemes. One is, of course, the Gavi Alliance. The other is under the WHO's COVAX scheme, as well as through Vaccine Maitri programs. Vaccines have been given as grants, as well as free vaccines have been given to nations that need it. Something very, very crucial at a time when vaccine equity has become a big question. It's not surprising then that praises have been showered upon India for its vaccine generosity. Take a look. So here are some numbers for you. It's believed that high-income countries with just about 16% of the population have snapped up and inked deals for 70% of vaccines that will be available. In fact, there's a study that says 84 of the world's poorest nations may not be able to vaccinate widespread at least by 2024. In the midst of this, let me tell you what India is doing. So 67 countries have received Made in India vaccines so far. Close to 6 crore vaccines have been supplied by India. Nearly 80 lakh vaccines have been supplied as grants. 3.38 crore vaccines have been supplied on a commercial basis, and 1.63 crore vaccines have been supplied through COVAX, which is the alliance of and the pool of vaccines that the WHO is putting together. So how crucial is this? To talk about this, I've got today with me Vishnu Prakash, former ambassador, and Dr. Ramanan Laxminarayan, director at CDDEP. Welcome to both of you, and thank you for speaking with us today. Ambassador Prakash, let me come to you first. So vaccine diplomacy, great. Put it in the context for us with what China is doing, because China is the other big supplier of vaccines. According to the World Economic Forum, between India and China, they are the 70% of the world's vaccines that are being produced globally. How important is it diplomatically as well for India to emerge as the pharmacy of the world right now?
Tamanna, greetings. First of all, I love the usage of the word vaccine equity that you mentioned earlier in the program. And that is where lies at the heart of the matter. One country is a part of the problem, the other country is a part of the solution. What we are witnessing is vaccine nationalism at one end, and India's belief that third world lives in developing countries are also as precious. Now, the reason I am not happy with the word or the usage of vaccine diplomacy is that, even long ago, when China was not on the scene, remember the arrangement with the Clinton Foundation, When the HIV AIDS drug cocktail was introduced for 10,000 rupees per head, it revolutionized the treatment of HIV AIDS, or Jaipur food. India does not believe in making benefiting from misery as some other nation may be doing. The reach of India, the way India has demonstrated its ability to rise to the occasion, to mass produce a vaccine at very reasonable prices, and as you mentioned, already 67 countries it has been sent to. One country promises, the other delivers, and that's the big difference.
Dr. Ramanan, how crucial is this from the point of view that India has a large population that needs to be vaccinated as well? Now, I put this in this perspective. There were reports recently that China, on the other hand, seems to be prioritizing giving vaccines to many countries in the world rather than their own domestic vaccine program. How crucial is it to keep that balance? And what are your views on the importance of vaccine equity? This is something, you have Dr. Tedros of WHO talking about all the time. You have the World Economic Forum talking about all the time. But the fact is that the richest countries are just literally hoarding right now because they can afford to.
Right, that's spot on, Tamanna. I think there's a lot of talk from the high-income countries about vaccine equity, and there is none of the action. In fact, they have exported virtually none of their vaccines, and except what is going through the COVAX program and the global programs, there are no significant bilateral programs through which those vaccines are reaching any other countries. I think what India is doing right now will have people will have a long memory about what's happening here right now. It is precisely for the reason that even though India has a large population which is yet to be vaccinated, but at the same time, it continues to assist other countries, that it's really, walking the talk. And even though there are a large number of cases here, and we probably are going through, this beginning of a second wave and so forth, that this is truly something which is generous and comes from the spirit of recognizing that most of the countries that India is providing the vaccine to, not all, but most of them, will not otherwise be able to vaccinate any of their people. And continues to be the case that many countries have not vaccinated even a single person. Now, in the grand scheme of things, I think that balance is just about right, because India is vaccinating about, roughly about, 4 to 6 million people a week at this point, and will get even further up from there. And, given the quantum of vaccine that's been given outside, it's sufficient to keep vaccinating at the levels that is possible in India while also meeting an external demand. But I think that using this opportunity to demonstrate, one, the quality of the Indian pharma industry, which is a very important signal, and second, India's willingness to step up when there is an international crisis rather than just watching out for itself. I think both of these are really important, and like I said, people will have a long memory about what happens, this year, in the future. That people will look to India to help solve a lot of biomedical problems in the way that it's helped with the COVID situation.
Just to add some data to that, allocations from global COVAX facilities and the numbers there, the Serum Institute of India contributes over 70% of those allocations. The rest is split between other nations and their companies. So we are definitely walking the talk out there. The question then once again is what happens once cases begin to rise? And Ambassador Prakash, do you think that that's going to be the challenge? We reported in the beginning of the show in our headlines as well that cases are spiking in Maharashtra, in Mumbai. You have, in fact, a court hearing right now asking that why a certain section of society, lawyers in this case, cannot be included as frontline workers and vaccinated. There's no doubt that there is a rising demand for the vaccine. How is India going to balance that need?
Tamanna, I think we are balancing it fine because the production capabilities are getting ramped up. The administration of vaccine is getting ramped up. I don't think too many countries can boast of such a record that India has. As my colleague was saying, 4 to 6 million people getting vaccinated every week. is certainly no mean achievement. Now, we are doing a good balancing job. We are making it available to other countries as well as vaccinating our own people. And that is the strength of India. Yes, when it comes to spike, there could be some spike, but remember, the doomsday scenario has been portrayed again and again and again when it came to India. When the Prime Minister decided to have a lockdown, the kind of reporting that was done the world over, oh, India is a third world country, oh, India, people will die like nine flies, etc., etc. I mean, and then there are countries out to or a country which is trying to discredit Indian vaccine, but it is boomerang. I mean, they supplied certain amount quantities of vaccine to Cambodia, and Cambodians are refusing to get that country's vaccine. So, India, what I think India is doing is the right thing. We are treating our people well, and we will be able to handle minor spikes. I have no doubt that the policies that we are following will prevail. If necessary, they will be tweaked because none other than the Prime Minister himself is paying personal attention to the entire process.
I just want to understand about continuing supplies, Dr. Ramanan. There are reports now that Serum Institute of India, in fact, has asked the government to intervene because some of the supplies required for manufacturing vaccines come from the US, and the US has tweaked its rules to make sure that those supplies are not available outside the country. Do you think that intervention will be required at this stage at some point?
Have to remember that although India produces a lot of vaccines, APIs for this do come from other countries. So we are dependent on that supply chain, at all times, and at certain times there may be need for intervention here as well. But the fact that we have not one company but two companies with large, significant manufacturing capacity that are engaged in this, which now opens the gates a lot more. The announcement of the phase 3 data from the Bharat Biotech on the Covaxin just last week basically now means that a lot of countries will be willing to accept Covaxin because now there are data, and now phase 2 data have been published in the Lancet yesterday as well. So that increases acceptability. So now we have two arms that are able to fire rather than really one, which was the case probably a couple of weeks ago. So I think there is probably some intervention that would always be needed to make sure that APIs keep flowing, but I don't think the constraint for vaccinating people in India is really the availability of vaccine. The constraint is really just how fast the delivery system can get people lined up and vaccinated. And I have to say that just comparing the US and India right now, most people that I'm aware of have already had one shot in India because the system is working to get the vaccine out, whereas people are still struggling, in the US and other high-income countries where it's been difficult to roll the vaccine out. So
that's such a valid point. The first 2 days. Yeah, absolutely. The first 2 days, sorry to cut you off, but I'm running out of time. I have to wrap, but that's a valid point. The first 2 days was chaotic. We reported it, we spoke to the authorities, and it has smoothened out as per most people who are going and what their experience has been. So we need to keep moving along in this direction. Thank you so much to both of you for joining us on The Lead Story this evening.